Gastric Medication Checkoff. Foundations, Spring 2017. Before, during, and after the procedure, follow principle-based checklist with all procedures. Identify the patient according to agency policy using 2 identifiers. Use standard precautions. Appropriate body mechanics. Provide privacy. Perform hand hygiene.
Good afternoon, AG. My name is Amanda. I'm going to be your student nurse today. How are you doing?
I'm doing well. How are you doing?
I'm wonderful. I'm going to go ahead and wash my hands here. Can you go ahead and verify your first and last name and your date of birth for me while I check your ID band?
Oh, sure. AG, February 14th, 1930.
Wonderful. Wonderful. Well, today I'm actually going to be administering some medications to you through that nasogastric tube that you have in place. We've had that in place for you to keep your nausea and vomiting under control, but since you're not reporting that anymore, the physician feels it's safe to go ahead and give you some medication through that tube, and we'll see how you handle that. How does that sound to you?
Sounds good.
Wonderful. Well, I'm going to go ahead and raise you up to a full sitting position here, and the reason I'm going to do that is because we need to have you sitting in a high Fowler's position when I administer these medications so that you can't aspirate any of them back into your lungs. Is that comfortable?
Yes.
Okay, wonderful. All right, I'm going to go ahead and prepare some things over here on my side table before I leave the room, and I'm going to provide you with some privacy. So what I'm going to prepare is I'm going to go ahead and grab a graduated cylinder, and I'm going to be filling it up to 200 cc's of fluid, which is per our orders. So I've done that. I'm also going to prepare a little medication cup here, and I went ahead and marked it at 20 cc's because that's what we're going to use when we give the medications. And I have a 60 cc barrel syringe, which I've also marked to 20 cc's so that I can measure correctly the right amount of medication. And I have a towel here for when we begin the medication. So I'm going to leave your bed in a low position, AG, until I come back because I want you to be safe. But when I come back, I'll raise you up for proper body mechanics for myself. Are you comfortable?
Yes.
All right, I'll be right back. I'm going to go prepare my medications.
Verbalize to your instructor the reason for the nasogastric tube. Discuss the safety of administering medication through the nasogastric tube.
So this patient has a nasogastric tube because she has a small bowel obstruction. That small bowel obstruction has since resolved, and she is saying that she no longer has nausea and vomiting. However, per our physician's orders, he would like it to remain in for 24 hours until she reports no nausea for that amount of time. If she reports nausea within that amount of time, we can resume suction and leave the tube in for longer. We put NG tubes down with small bowel obstruction in order to help patients that are constantly nauseated. The disease process, small bowel obstruction itself, means that there is a blockage in their bowels, which means that all of the fluids above that blockage are backing up and causing the patient to have massive amounts of nausea and vomiting. So we place the tube in order to help with that.
Be sure to turn off suction and verbalize the rationale.
Right. So before I would leave the room, I would need to turn off the suction on this patient. Now, she is hooked up to low intermittent suction at this time, which was per her orders. However, before I can give her meds, we need to make sure that she doesn't have too much residual fluid building up in her stomach. So I would turn that off, and then I would also turn off the tube to the patient on this valve. And the reason we turn it off to the patient is because that way no fluid can come back through and come out, and that way there's no air entering the patient's gut. So it's off to the patient, and I've turned off the suction.
Prepare and administer medications per MAR using 3 checks of 6 rights.
So I'm going to come over to my medication cart, and I'm going to perform hand hygiene again, and I would have done that after I left the room as well. I'm going to clean my hands, and then I'm going to go ahead and I'm going to do our 3 checks. Our first check is going to be when I pull the meds out of the drawer and check them against the MAR here. And I'm going to do the 6 rights while I do that. So our first ordered med is 40 milliequivalents potassium by mouth twice daily. And this dose is actually going to be given at 2100 at night, and I see that here on the MAR. So I'm going to reach into my drawer, and I'm going to find myself potassium, and here I have a potassium, and it says 20 milliequivalents which is half of the dose that I need. So I'm going to find another one. And here we are. And this one also says 20 milliequivalents. Now they both expire on November 2017, and they are the correct med. And potassium can actually be given as an elixir form as well. So my best option here for this patient, since I'm giving this down an NG tube, might be to call the pharmacy and obtain an elixir form of potassium. I've called the pharmacy and done that, and they don't actually have an elixir form of potassium. So today, instead of crushing potassium, because it's actually a do not crush medication, what we can do is we can actually dissolve it. And the reason potassium can be dissolved is because it's made up of little tiny capsules of medication all connected together. And when you dissolve it, all that happens is you break those connections and you don't actually dissolve the little capsules. So, and I'm also going to verify at the same time that this is in fact for my right patient, and that is AG right there on my monitor. So I know this is the right patient, this is the right route we're going to give it, this is the right dose, this is the right time. And then at the end of my checkoff, I'll do documentation, which is our last 6 right. And so then I would do that same process with my next 2 meds that are part of my orders. And so I'm going to go ahead and reach in and grab those, and we're going to say that I've done that. Now, before I leave my med card, it's important that I do my second med check. And that is going to be, I'm going to compare that and do that once again. Say it's the right patient. It is 40 milliequivalents of potassium right there. This is the right route. It's PO, the dose, the med, and it's going to be given at 2100 at night. And I would do the same with those meds. And when I do that, I'm going to go ahead and put them in a cup to prepare them to take them into the room. Okay. Make sure my med card is locked and cleaned and ready to go. And if I needed it, I do have a pill crusher right here to crush those medications. And I could take that into the room with me, or I could prepare those here. I'm going to prepare my meds in the room. All right, so I'm going to go back in and I'm going to say hello to my patient. Hello, AG.
Hello.
I've got your medication here that we're going to be giving down your NG tube today. Can you verify your name and date of birth for me again?
Oh, sure. AG, February 14th, 1930.
All right. I would perform hand hygiene as I came into the room, as I know you all will do.
Don non-sterile procedure gloves.
So after my hands dry, I'm going to go ahead and grab my non-sterile gloves here. Get my hands dry.
Place patient in sitting high Fowler's position. State the importance of this position.
So AG, I'm going to again make sure that your head of your bed is all the way up and you're in a high Fowler's position. And again, that's so you don't aspirate any of the medication and free water that I'll be giving you down your NG tube. Are you comfortable in that position?
Yes.
Wonderful. I'm just going to raise your bed up a little bit here so that it's at the right height for me, so my body mechanics are not, I'm not hurting myself by leaning over. So I'm jumping out of the bed on me here.
Oh, okay.
Okay. Figured you'd be agreeable to that. So your tube is still off to you, and suction is still turned off, and you're not reporting any nausea or vomiting?
Not right now, no.
Okay, wonderful.
Check placement. Verbalize that you have reviewed the radiology report and auscultate.
Per my orders from the physician, he ordered that radiology come up and do an x-ray scan of AG here so that we can verify the placement of the NG tube in her stomach. So I have verified that order with the physician and per actually looking at the x-ray itself, so I do know that it's safe to administer these medications per that scan. However, I'm also going to auscultate and listen to the placement of the tube to make sure that it hasn't moved since they took the scan and that I can hear that it is actually in the gut. So the way I'm going to do that is I'm going to go ahead and set my stethoscope in my ears. And I'm going to grab myself my towel here because it could get messy. And it just protects the patient from getting wet.
I appreciate that.
Oh, you're very welcome. So I'm going to go ahead and draw up about 10 cc's of air, just air into my syringe there. And I'm going to put the syringe right on top, okay? And then I'm going to turn my stopper off to the suction tubing. And by doing that, I'm creating a passage that the air can then flow down into the stomach. So then I'm going to place my stethoscope onto the patient's stomach, and I'm going to actually inject the air through the tube, and I can hear the bubbles in the stomach. So I know that the x-ray and my auscultation have verified that the tube is in the correct place. Now I'm going to go ahead, while I'm taking my stethoscope off, I'm just going to turn it off to the patient, but I'm not going to remove it yet.
Check for residual volume.
All right, so now we can check for residual volume. I always think it's safer to turn it off to the patient even when you just step away for a moment. So I'm going to turn it back off to suction again. And the way to check for residual volume is what we're actually going to do is we're going to pull out the gastric content from the gut itself. So we're going to just pull back. And as I'm doing this, my instructor will let me know how many cc's of residual volume I have.
45 cc's of residual.
All right, so I'm going to pull back to 45. And now it won't pull anymore. I've pulled all of the residual volume out of the stomach. And so now the thing that we do with this is we give it back to the patient. And then we know how much is in the gut. Now, if this was greater than 100 to 150, we might need to call the physician and we might need to resume suction because that could mean that her gut is not draining fully. But 45 is a safe number for us to be able to administer medications. So I'm going to go ahead and I'm going to turn this off to the patient one last time, and now I'm going to remove my tube. I'm going to leave this towel placed here because now it's time to start our medication process.
Prepare first medication.
All right. So the first medication we're going to give is going to be my potassium. And what I'm going to do with the potassium is I'm going to open them actually into our little med cup here that we've marked at 20 cc's. And once I do that, I'm then going to pour from the 200 cc's in my graduated cylinder into this up to the 20 cc mark. And by doing that, I'm allowing my potassium tablets to start to dissolve. Again, if I had an elixir for potassium, all I would have to do is open that elixir and pour it in and draw it up into my syringe. But I'm going to let these dissolve first. So they're dissolving, and as they're dissolving, you can give them a quick stir just to get all the particles kind of all around in there. And then as the water is swirling, I like to draw it into my syringe so that I make sure I get all of those med particles up. And make sure, if you need to, you can push this a little bit back in and make sure that you're drawing up all of the medication particles within that water. So here I've drawn a little bit of air into my syringe, so what I'm going to do is just let it settle. Push the air out just like you would when you're drawing up meds into an IV or intramuscular syringe. Okay? So I'm going to do that first. Oh, hold on.
Flush the tube.
Yes.
Use the correct type and size syringe. To
So-
flush the tube, draw up 20 cc's of free water and depress plunger.
So we've mixed our med and we're ready to go. But what I'm going to do first is I'm actually going to go back to my graduated cylinder of 200 cc's. I'm going to go over here. And I'm going to go ahead and I'm going to pull up 20 cc's of free water. What we're going to do with that first is we're going to come back over to the tube. And we are going to flush out that residual that we just gave back to the patient. We're going to flush that out and kind of flush our tubing and prepare the way for the medication that we've prepared, okay? So I'm going to go ahead and turn it off again, just like I did when I drew my residual, off to suction. And I'm going to flush with 20 cc's of free water.
Draw up prepared medication in plunger.
All right, so then I go back.
to NG tube, depress plunger, and give the medication.
I'm going to draw up my 20 cc's of potassium, and I've got it all in there, okay? So here is my potassium prepared in my syringe. I'm going to go back and I'm going to do the same process that I just did with my water flush. I'm going to turn it off to suction and open from the tube to the patient.
Smaller tubes require instilling with a 30 to 60 milliliter syringe. The medication can be poured with larger tubes.
I have administered my med. So the next thing to do,
Flush the medication through the tube by instilling an additional 20 to 30 milliliters of free water.
so I've poured another 20 cc's into my little med cup here. I'm pulling it up into my syringe, so I've got my delivery set. And we're going to do the same process one more time. This is with free water again, and this ensures that all of the drug that's in the tube ends up in the gut. Okay, so now we're going to depress and give that 20 cc's of free water. And turn it back off to the patient every time when you're done.
Verbalize to your instructor, I would repeat this process for each medication with a flush after each administration. Verbalize each step independently for subsequent medications.
So for the next two medications on our list, I would go ahead and I've flushed it after I gave my potassium, so that can count as my flush before my med. So then I can pull up my next med, which might be trazodone. That might be the next medication that I prepared. And I would go ahead and give that with 20 cc's of fluid and then flush with 20 cc's of fluid. And I would do the same thing with our Reglan afterwards. And then I would make sure that when I'm done, that it's, again, off to the patient.
Have patient maintain a sitting position, if able, for at least 30 minutes after medication administration. Verbalize the correct time length for this and the rationale. Verbalize how long before suction can be resumed.
So AG, I'm actually going to leave you in this upright sitting position if you're comfortable with it.
Yes.
Wonderful. I'm going to lower your bed while I'm talking to you here. The reason I'm going to leave you in this upright position is, again, because I want to let those meds absorb into your stomach and get into your system, and this will ensure that they stay all the way in your gut and they don't come aspirating back up and cause you any gastric reflux, all right? I'm also going to leave your suction turned off while the medications are absorbing, and that's so we don't accidentally suck the medication back out that we've just administered. We're going to leave the suction off for about 30 minutes, which means I'll be back in 30 minutes to check on you and see how you are. If you have any nausea between now and when I come back, please push your call light and let me know, because we can turn back on the suction if need be.
Oh, okay.
Wonderful. Wonderful. Are you comfortable?
Yes.
Awesome. All right. Well, that concludes my medication administration.
Document.
And now I'm going to go ahead and I'm going to go and document. If you need me for anything, here is your call light. And I've left you in a low position, even though you are upright. I'll go ahead and maintain your privacy by leaving your curtain there. So as I leave the room, I'm going to do some hand hygiene, grab my orders, and make sure that all of my things are cleaned up, and go and document my DAR note for my instructor.
What if